Hello everybody, welcome to Module 7, the module of lower extremity and podiatric anatomy. Podiatric is in reference to your feet or areas near the feet. Great job on your lab assignments last week. I realized that was quite overwhelming as that was the first time you will have ever done an assignment like that, but the good news is each week that format will continue becoming more familiar to you because every week will be quite similar. Same setup for this week in Module 7. We will be doing the lab assignment with the workbook pages as well as the flashcards. Same things on the flashcards as you've done for last week. The workbook pages you can submit to me however you choose, whether that's entering text boxes into the workbook pages themselves or submitting a document out to me that you have typed. Either way works for me, but I always want them all in one document. So your workbook pages and your flashcards need to all be on one document when you submit them to me before Saturday morning. Okay, so one document for that. I want to call your attention to the femur projection for this module. The femur projection is a very long bone. We know that. The femur is the longest bone in our body. But I want you to know that the femur has two AP projections, one for the upper area of the hip and then one for the lateral area of the hip. So AP means a straight view, lateral means a side view, so two for the upper and then two for the lower. So one for the AP portion of the knee up, one for the lateral portion of the knee up, with having overlap in between those four pictures. So for the femur, I want you to make sure that for the projections you are telling me you will be doing four of them and what they are. Hip down, AP, hip down, lateral, knee up, AP, knee up, lateral. Okay, so make sure you note that for your flashcards for this week. For your written assignment, same exact format as last week for the written assignment, except this week we're talking about lower extremity, so same format. First paragraph should talk about the story, how the patient was injured, what happened to them. Did they fall? Are they ill? Is it a chronic disease? But always keep that short and concise, okay? A couple sentences is enough. Your second paragraph is going to be the big chunk of your paper. I want you to tell me the series of x-ray projections you're going to perform on this patient based on the reason that they're coming to your emergency room, clinic, wherever it is that you are encountering this patient. Okay, so for lower extremity, that could be 3 pictures of the foot, an AP oblique, and a lateral, or the ankle, 3 view. AP, oblique, and lateral of the ankle. The lower leg, tib, fib, could be AP and lateral, lower leg, tib, fib. Again, you can find those series of x-ray projections at the end of your PowerPoint slides, as well as on your flashcards, on your lab assignment that you'll be completing. 1 to 2 pages, no less than 1 page, no more than 2 pages. And if you're doing research, which I would assume that you are, APA citations with the references page at the end. That should always be a separate document. Have that submitted to me by Saturday morning at 9 a.m. And as always, your quiz is due Sunday by midnight, and we will be doing a review for that in class this Wednesday. I'll see you all then. Have a great week.